Yo, feel like it's feel like yo, feel like it's welcome. We are going to get started in just a minute. We're letting people get into the room. Welcome you all. We'll get started in just a second. All right, so I'm going to go ahead and kick us off. Good afternoon. My name is Lauren Jones. I use she, her pronouns. I'm the Director of Diversity, Equity, and Inclusion here at the School of Public Health at the University of Minnesota. I do want to welcome you to today's Justice and Public Health presentation, which will be led by Nate Carter. I'll introduce him in just a second, but I'm going to start off with acknowledging that the School of Public Health at the University of Minnesota Twin Cities is built within the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, Minnesota Mikoche, which loosely translates to the land where the waters reflect the skies. We'll share some concrete resources for supporting our Indigenous relatives in the chat shortly. I also want to point out that closed captioning is available. You can access that by choosing the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who's providing our tech support today, via the chat to ask questions about accessibility. We'll monitor the chat for questions, as well as share links to our evaluation and information about future justice and public health events. The Justice and Public Health series was started in 2021 as part of our commitment to justice and anti-racism. We've been hosting monthly events with local and national experts around the topics of public health. The speakers and presentations in the series help to ground us in theory and practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of a broader change happening outside of the School of Public Health, or SPH. If you are interested in staying abreast of other justice and public health events or other things happening at School of Public Health, please be sure to fill out our event evaluation after this and check the box that says you want to receive notifications about upcoming events. You may also visit our website at any time. And I want to now welcome our speaker for today. Nate Carter is a seasoned leader with extensive experience in data analytics, community advocacy, and has served as the head of data analytics at Apple before transitioning to a nonprofit org focused on gun violence and DEI. As the Operations Equity Director at Minnesota Department of Human Services, Nate leverages his passion for numbers, statistics, and problem solving to drive meaningful change. With a deep commitment to supporting people of color and strengthening the Black community, he brings a unique blend of analytical skills and heartfelt dedication to his work in addressing gun violence and promoting public health. Nate is also involved in various community initiatives, including 100 Black Men, the Fatherhood Project, and healing circles both inside the prison system and outside, where he actively contributes to building safer and more inclusive communities. He's also brought two co-speakers with him today, and I will let them introduce themselves, but for now, I will give it over to Nate.
Hey, you most amazing people out there. My name is Nate Carter. It is a pleasure to be here with you guys today. I am so excited to be able to do this work and to be here and be a part of this. So this work is so important that I believe in not necessarily working in silos, but bringing community with me. So I brought my community with me. I have Connie Rhodes, who is the Executive Director of Restoration Incorporated, who has an extensive background in culture and community, and is respectfully known as the peace promoter throughout all of the country. She's been on Gayle King. She's been interviewed by Gayle King. She's been at the White House in several different amazing opportunities. In a minute, I'm going to let her introduce herself and tell you a little bit more about her. And I also brought Lauren Feiersigner with us today. Lauren is a seasoned person when it comes down to policy, and you will get that opportunity to get to meet her. She is the founder of an amazing organization called Bridges International, I'm sorry, where they focus on, recreating and connecting that bond between people that are coming and reaching the US and what they do when they get here. So I think that her ability to understand and advocate for the policy is really great. And then, as you heard, I'm a data guy, so we're going to do a little deep into some data. So without further ado, I will pass it over to Connie Rhodes.
Hi, everybody. Good to see everybody. Good to see everybody here. We're going to begin today with some breath work. And in the work that we do, before I do that, though, I'd like to just introduce myself a little bit more. Thank you so much, Nate. And thank you, everyone, for this opportunity to be here with you today. So we do a lot of work around trauma healing in our gun violence prevention work. I am the founder and executive director with Restoration Incorporated. And we have I've been doing this work probably about a little close to 30 years. I've been working with gang and clique affiliated youth, as well as in the arena of gun violence. Our mission is to reduce gun violence and to heal communities of trauma. We are blessed to have a group of people who are credible messengers, and you'll hear more about credible messengers a little bit later. But we have a contract with the city of Minneapolis to do violence interruption services on the north side of Minneapolis. And with that work, we've been able to stop gun violence in a very and reduce gun violence in a very impactful way. And last year alone, we had 465 mediations. So I'm very proud of that work that we do with that as well. In addition, we have case managers, we have mentors, we have wraparound services. We have a youth center that just opened up at 3452 Fremont Avenue North. And as Nate said, we've done this work nationally. I had an opportunity to speak at the White House about the work that we're doing around gun violence reduction and using indigenous cultural, spiritual, and evidence-based practices to impact gun violence. And so I feel like it's my life's work. Something that's very close to my heart is indigenous practices. And as we heard, we are sitting and standing on the land of our Native people, and so of our Native brothers and sisters. And so just in acknowledgement of that, I had the opportunity in the 90s to be trained in circle keeping. I've been a circle keeper for 20 plus years. And so I would like to start with some breath work. And as a therapist, I know that breath and somatic work is important, especially when you're dealing with a topic like gun violence. And so if you wouldn't mind joining me, and if you're able, let's just do some breath work together to kind of center ourselves and to prepare for some of the information which may be jarring that we may hear. So I invite you, if you're able, to sit up as straight as you can in your chair. And if you're able, put your feet flat on the ground and allow the soles of your feet to connect with the ground underneath. And I invite you, if you're able, to close your eyes. If it feels right and good for you, close your eyes. And I invite you to put your hand over your heart, to notice your heartbeat. Notice its rhythm. Notice its strength. And I invite you to take a slow, deep breath in through your nose, as deep as possible. And slowly blow out through your mouth as if you're blowing out a birthday candle. Let's do that again. Slowly and deeply breathe in as if you're breathing in the smell of a beautiful flower. And slowly and deeply breathe out as if you're blowing out a birthday candle. So we'll do that again. And this time I want you to imagine that you're breathing in all the things that you need to feel safe, to feel love, to feel at peace. So let's do that again. Let's breathe in deeply, breathing in those things that you need, love, peace, joy, whatever those things are, and hold it there for a second. And slowly and deeply breathe out through your mouth, breathing out everything that may hinder you today. Worry, anxiety, anxiousness. Thank you so much. And when you're able, when it feels right for you, you slowly open your eyes. And as you open your eyes, I invite you to just let your hand fall where it may. And then reach up for the sky. And wiggle, wiggle, wiggle your fingers. And as you're reaching, just take a breath in. And slowly exhale as you let your arms fall down if you're able. And it feels right. Shake them out. And let's get started. Thank you so much. So I'll turn it back over to Nate. Thank you so much.
So before when Lauren comes up, we'll let you actually let's do that now. Now that we have the breath work out of the way, let's go ahead and talk about you, Lauren. Let's introduce the people to you so we can get right into it.
Awesome. Thank you so much. Good afternoon, folks, and thank you so much for making time to sit with us during this conversation that is very necessary, very vital for all of our communities, regardless of which intersection we exist at or in. My name is Lauren Feiersigner, as previously mentioned, and I am the founder of a consulting agency named Bridges International LLC, based out of Minnesota, but I work with individuals and organizations across the country. Part of what I do is attempt to figure out how we can humanize policies. I very much lead with I try to lead, and actually I'm trying to be intentional in leading from a perspective of understanding that not everybody has historically had access to policy spaces. And so when we talk about policies most of the time, many people who come from historically underrepresented communities don't often understand how to engage with policy. So part of my work, a large part of my work, is trying to figure out how to create access points. And I talk about language of access in a manner that allows us to talk about policies in a way that is incredibly relational to the people that we attempt to serve. And then also recognizing that policy does not have to be this ominous thing. And we also don't have to approach policy from the perspective of the historical lens in which it was presented, which is very much geared to the traditional systems, as opposed to recognizing the diversity of people that policies serve, as well as the diversity of opinions, as well as lived experiences. So most of what I will do here today will be based off of trying to humanize policy, but also trying to create that intersection point as it relates to how we talk about policy and how we can recognize the humanity of all those that we're serving. Thank you.
I love that. I love that. Now you see why I brought them, right? So here we're at this point in our thing where I have to say the thing. So you'll get to know me. And I always say the thing, right? And so the thing is, the information that we're about to go through, it can be very, very, very jarring. It can be very upsetting. It can be very uncomfortable. But my hope and my goal is for you to sit in your uncomfortabilities, right? To allow yourself to think outside of your present norm, or even if this is your lived reality, and understand how gun violence and the things that we're facing isn't a monolith, and it is something that every one of us feels. whether or not you are in close proximity or not. And I don't believe that you're not in close proximity. So, my ask is that you sit in your uncomfortabilities and learn and grow with us. We're going to start this off with Connie. You ready? You're muted.
So, you know, what we know, that as of 2021, the CDC reported that there were around 48,000 gun-related deaths in the US. And that's very significant. And according to the quote from Dr. Walensky, CDC director, gun violence is a public health crisis that affects the safety and well-being of communities nationwide. Let's just think about that for a moment. And as we go to the next slide, we see that, this is something that affects young, old, Black, white, right? And all in between, all cultures, all backgrounds. And it's very painful for community. And so today I want to discuss gun violence, not just as an issue of statistics or policy, but as a deeply personal and communal challenge. Gun violence doesn't just happen. It happens somewhere in places that have histories, cultures, and people. And many of our Black and brown communities, the issue goes beyond the violence itself. It's about the erosion of cultural and community ties. My goal today is to emphasize the importance of rebuilding and reimagining those ties to find a way forward through community healing. And so, as we look here at a visual, which I have participated in more than I would have liked to in our communities, a way of healing, a candlelight vigil for the death of someone who has died. So a community is like a ship. Everyone ought to be prepared to take the helm. And so, why does gun violence happen? Well, we see that gun violence stems from generations of disenfranchisement, of poverty, trauma, and the breakdown of communal bonds. When communities lose the power to define their own futures, violence can fill the void. Communities are broken and so many resources are missing. When we look at why gun violence thrives in certain places, we often see a lack of economic opportunity, educational resources, and mental health support. But the issue runs even deeper. In many of these communities, violence has become, unfortunately, normalized. I don't know how many young people that I see a day, and it's like, oh, so-and-so got shot. Oh, my friend died. Oh, our classmate is gone. It has become normalized, which is really painful in and of itself. And this isn't because of the presence of guns, but because when this happens, there becomes an absence of hope. The generational trauma, the systemic poverty, and the social isolation, unfortunately, it creates a breeding ground for violence. And as we can see from communities like where I serve, North Minneapolis, gun violence is often the only visible outlet for long, buried pain. And this is not just in that community. There's so many other communities where we see this happening. And so I wanted to share with you, kind of like a backstory of why we see this in our community and the impact of gun violence. You know, people often think, oh, these young people, they're just bad, or they're just undisciplined, or, you know, they just want to be involved with the gang, they just want to hold a gun. I'm here to say that there's a deeper reason. That's why it's a public health epidemic. There's an underlying cause. And so the story that we're going to share, and we're going to call him Darnell, is going to just kind of illustrate the tragedy and the impact of gun violence on a young person's life. Now, Darnell was raised in North Minneapolis, an area known for its vibrant culture, but also known for significant challenges, including high rates of gun violence. Growing up, Darnell experienced the trauma of losing friends to shootings, which created for him a sense of fear and helplessness in his community. At 16 years old, Darnell's best friend was shot and killed just a few blocks from his home. This tragedy had a profound impact on him. The grief that was never addressed turned into anger. And then Darnell began to feel the pressure to retaliate against those who he believed were responsible. Now, he had never gotten in trouble before, but the emotional toll was compounded by the lack of mental health resources. In his school, and the schools in this neighborhood oftentimes are underfunded, and counseling for him was very scarce. Darnell's family faced financial instability. His mother worked multiple jobs to make ends meet, leaving little time for her to support her children, especially emotionally. Now, also the stress of living in a violent neighborhood combined with economic struggles created an environment where violence felt like a part of his daily life. And in high school, Darnell was struggling academically. Without adequate support, his grief and his anger manifested into behavioral issues. How many times do we see this happen? Leading to suspensions and many missed opportunities. Many of his peers were in similar situations, caught in the cycles of violence and trauma that seemed unbreakable. Community organizations worked hard to provide the resources, but they were often overwhelmed. Programs that aimed to engage youth in positive activities were underfunded, and many families lacked access to safe recreational spaces. And this was true for Darnell. Darnell participated, however, in a local mentorship program that offered him some relief and guidance, but he still felt trapped in the circumstances and the grief and the pain that was around him. Ultimately, Darnell's story reflects a broader narrative in North Minneapolis, where limited resources, economic hardship, and chronic stress create cycles of violence. Many people in the community are left searching for hope amidst the pervasive impact of gun violence, illustrating the urgent need for systemic change. And what we see is that Darnell, the end of the story, I wish it was a happy ending. Darnell ended up carrying a gun, started carrying a gun himself. And from there began to hang with the wrong folks. And from there, ended up going to jail for having a switch, which he bought. A switch is it's an apparatus that changes a regular gun into a machine gun that can let off many rounds at a time. He ended up going to jail. And so it's a really sad story, but it's something that we hear and see all the time. And so that gun violence not only affects the family member and the family members and those who we lost to gun violence, but it also affects the children who are around, the classmates, the friends, and it can change the trajectory of their lives. That's why we have to have a public health approach to helping to reduce gun violence. Next slide, please. Okay, so we want to talk about something in the chat. And when I really, I just need to center myself because when I think about the young man, Darnell, and I think about there's so many ways that we as a society could have helped him, could have helped his friend who was murdered. What can we do now? So what I love to do, what we'd love to have you do is to answer this question in the chat, okay? And so the question is, what are the key systemic failures, that contribute to the cycle of gun violence? And how can the public health policies address these root causes? Now, I'm asking you because oftentimes people see us as a subject matter experts, and that's great. But also, people who do the work, people who influence policy, people like you who are in this room, who we appreciate, we're so glad you're here. You have answers, and it takes all of us. It takes all of us to come up with these solutions. And so I ask you just to put your thoughts in the chat. What are the key systemic failures that contribute to the cycle of gun violence, that contributed to Darnell and his friend and the community around? And how can public health policies address these root causes? So we'll just take a few moments and add what you have in the chat. Your voice is important, and we look forward to hearing from you. Yes, a lack of social justice. Yes. Keep them coming. Great. Lack of resources. Yeah, for homeless folks. Definitely. Need for more safe spaces. Yes. Disconnection from. Yes. Loss of hope. Yes, they're coming. They're coming. Thank you. Neighbors. Yes. All of these are excellent. Yes. Built environment. Yes. Safe and good affordable housing. Yes. Lack of mental health resources. Lack of political help. Failure to support parents. Yes. What wealth of knowledge is coming. I love it. Keep them coming. More investment in education. Lack of comprehensive registration, gun registration system. Yes. Lack of political will and protection of powerful lobby interests. Lack of background checks. Yes. Thank you so much. Yes. Yes. Thank you. Thank you so much. I appreciate your ideas around that. And so as you all are thinking more about this, even take this into your work later, and just think about what's your role and how in the public health spectrum, the ecosystem, and what can we do to reduce these gun violence, this cycle of violence. Political division, yes, we see that a lot. Yes, communities against each other, so true. Thank you. Anti-Blackness, yes. More comprehensive gun policies. Help for parents before birth. That's right. Trauma affects the pregnancies. That's so true. For generations and generations. Yes. Excellent. Need for a stable and safe home. Yes. Lack of nearby facilities and practitioners to treat gunshot wounds. Yes, we see that. One of the things that I did is I worked to get the Next Step program, which is a hospital-based violence intervention program here in Minnesota, helped to get that off the ground from 2016 to 2020. Yes. Disinvestment in communities. Yes. Prioritization of, yes. Seeing differences as a negative. Yes. These are all excellent. And they all are ways that we can address these root causes. And some of these are also the reasons, the failures that we're seeing. Are there any other thoughts? These are amazing. Lack of social justice and equitable jobs, better neighborhoods, and for systemic poverty. There's so much systemic poverty, yes. Public health can address this by developing community-based approaches. Yes, and understanding the causes and finding common solutions. Excellent. Yes. Not providing space, time, and understanding, and the need to grieve. We see this all the time. Where someone dies, a kid's friend, a classmate, maybe they bring a counselor to talk. But many times there's no space. Universal basic income. Great idea. Yes. Violence interrupters in the community. Yes. Thank you. And we see that the places where the violence interrupters are, we see it does reduce violence. We see that there's so many, when they say, oh, we were going to come over there and we were going to shoot up XYZ. We've had members who are involved in that kind of tertiary level of violence tell us that, hey, we passed by because of you all. They've said thank you to us. And so, yes, violence interrupters in the community is very helpful as well. Yes, lack of healthy understanding of masculinities. Yes. Yes. Amazing. So I wanted to take the time to hear from you all because, like I said, we have to do this together. And this webinar is a way to think it through, a way to bring light to what's going on.
I don't think we can. One of the things that we were thinking is we were going to create these breakout sessions, but unfortunately, due to technology, we can't. So we're going to just have these conversations collectively through the chat and just how we show up with each other. So there's so many great responses, so many great ideas that are in these. So I want you to stay in those, and even while you are there, and you are feeling the backlash of emotions and uncomfortability, my hope is that you see it, right? And that you understand that there's so many things that we can switch and change, and keep that in the forefront of your mind as we go through this presentation.
Yeah. Thank you, Nate. Thank you so much. And, and we have one that says secure firearm storage laws. Yes. And I'd like to add to that as well. We pass out gun laws. And having a gun lock, having a safe firearm storage is going to create time. There's so many statistics that talk about it, that barrier of time. It gives you a chance to rethink a decision, to use that firearm. Okay. And all of these are solution-based, and I love that. And we're looking at also at some of the policies and the ways we've failed. And, let's see if we can now focus on collaboration, right? So what would that look like for you to collaborate with someone else? Or what's a way that you could bring what you have to offer to this solution or this to address the root causes? Is there something that you, in whatever lane you're in, is there something that you specifically can do? Anybody? Any thoughts? Well, I think one thing that we're all doing here is we're all gathered together and we're bringing our thoughts to the table. Yeah, thank you. Talk and write letters to elected representatives for sure. Yes. Help take care of my neighbors and help people get to know each other. Yes. Bring in the data, like work in public health. Yes, thank you. So important. So important. You'll get a chance to hear more about data. Great. Well, thank you. This is amazing. Reach out. Yes. Vote. Yes. Yes. Thank you so much. This is great. This is wonderful. This has been awesome. I really love what you all are saying. Talk to the policymakers. Yes. And just know wherever you are, you can make a difference. You are making a difference. And all of us together, we can end violence. Support community-based initiatives like Cure Violence, yes. And other local violence prevention programs, yes. We use that Cure Violence model, yes. Embrace all of our communities. Everyone is loved and important and they matter. Reach out to places like UROC, yes. Yes. Volunteer to neighborhood school, I love it. I love it. Contribute to mutual aid initiatives, yes. Beautiful. Okay, amazing. Thank you so much. So we're gonna move on to our next slide. I love it. Tutor and volunteer at city and county libraries. I love it. I love it. And let's be true to it. Let's start doing some of these things, right? We can make a difference together. Educate myself. I love it. Okay. Thank you so much. So now let's see, let's look at that. Who's responsible for gun violence? Basically, we've all said here together as we put together this discussion, we're all responsible. Community members, leaders, and the systems that have failed to provide safety, resources, and mental health support must all share accountability. Responsibility is shared. Yes, individuals who commit acts of violence must be held accountable. But it's also about the systems that have failed our communities. When schools close, and jobs leave, and mental health services are unavailable, we are creating conditions that breed violence. Our responsibility as a society is to ensure that we are building systems that foster life, not destruction. This means funding education, healthcare, economic development, especially in communities that have historically been left behind. Responsibility also falls on us as community members to, as someone said, know your neighbor, to engage with each other, to not allow isolation and despair to go unchecked. Many times we know our neighbors and we see when someone is off or a kid is struggling or, just having just a, hey, let me check in on you. Okay? It's really, really important. Next slide, please. So who is impacted? Gun violence doesn't just claim victims, it affects entire families, communities, and future generations. It leaves emotional scars that last a lifetime. And we see here, and this is a family. that is bearing their loved one, and the pain of a mother to lose her son to gun violence. Entire families, neighborhoods, and cities feel the impact. Mothers who lose their sons, children who lose their fathers, communities lose future leaders, and for every life taken, hundreds are left to mourn. Hundreds are left to mourn. And the scars last for generations. And it's not just the person who died, their family, but it's also their neighbors, the community. For example, in places like Chicago and Baltimore, we've seen the psychological toll on gun violence that it takes on their entire communities. We've seen it happen here in Minneapolis and St. Paul, and in fact, in the 7 metro area. Seen it happen. And the work that we do at Restoration Inc., we see it all the time, up close and personal. And so what about those workers? What about those of us who are out on the street? It affects us as well. Entire communities. Children grow up in environments where they expect violence, where it's not an if, but when someone they know will be hurt or killed. This collective trauma is something that we have to address. Next slide, please. Now, happy to be in the company of so many amazing public health practitioners here today. Many of you all are in the lane of public health, and some are not. There are many of you who are not. But whatever your lane you're in, we have to take a look at this as an epidemic. It's an epidemic, and public health, that's what public health practitioners do. They deal with epidemics, and they deal with community healings, and they deal with the data, as someone said. And so as public health, how can public health support? And so, public health officials must embrace community-based healing, right? What does that look like? Community-based healing, creating safe spaces for dialogue, right? Mental health support, rebuilding trust in marginalized communities, looking at ways to bring healing, to bring wholeness. Just as if you're looking at an epidemic, it's just not enough to treat the physical wounds, but we must also treat the emotional and psychological wounds left behind. Trauma-informed care is essential. Programs that focus on mental health, community rebuilding, and creating safe spaces for a conversation are critical. For example, the work that we do as community violence intervention workers, the community violence intervention ecosystem is huge. Someone mentioned Cure Violence earlier. Yes, Cure Violence uses a public health approach. Human Justice uses a public health approach. Our model that we use, Safety Restored, uses a public health approach. And what we mean by a public health approach is looking at violence as an illness, an epidemic, a disease that we can cure. It's a holistic healing. It's bringing together not just the individual, but the community as a whole. It's looking at ways that we can take someone who is at the tertiary level of violence. And at the tertiary level of violence, that young person is what you would maybe call, he has the epidemic, right? And then bringing in the inoculation, the medicine, which is bringing in, organizations, community violence intervention, for example, like a Cure Violence model, where you're working with that person at the tertiary level, providing a difference, a way of rethinking, trying to help them reshape the way they look at violence. And we've seen this happen over and over again, especially in the work that I do with Restoration Inc. We've seen young people who are at the tertiary level of violence, who are shooters. We work with those who are shooters, okay, and help them to broaden their horizon, to see there's a different way, to realize that there is hope, to get them into some counseling, to do healing circles, to mentor them. And what we've seen is young people change the trajectory of their lives. Some of the young people that we were working with 4 years ago on Laurie and Logan, where it was extreme gun violence, some of those young people are not standing out there on the corner. They're not carrying pistols anymore. What are they doing? We got a young man right now who's an apprentice for a baker, because his goal, which we found out through using the Cure Violence model, which is to take them out on participant outings and find out using goal setting tools, right? We found out that he wants to be a chef. He loves to cook. He cooks for his family. He loves the cookies that we bring out as a as an engagement tool to engage with some of the hard to reach youth and young adults that are at the tertiary level of violence. He loves those cookies. But guess what? We were able to work with the baker, and he became an apprentice and knows how to make those cookies. Okay? So life-changing stuff. He's not out there on the block selling dope anymore. He's not out there on the block carrying a pistol. But he's taking care of his family. And so together, we can change this. Public health is the way to go. I believe that public health approach is the way to go. I don't believe in the way that locking them up and throwing away the key. And I just don't think that works. Doesn't work as well as changing the mindset of fostering hope, of using public health approach to make them feel better, heal them from this epidemic, heal them from this disease of violence. Okay, so we can go on to the next slide. I get excited about that because I believe that the public health approach is the way to go. That's why we use evidence-based strategies like Cure Violence, Human Justice, Safety Restored. So the next, we're going to go back out to a question. And go to a question again. Love your participation. I love that we're on the webinar and we're still engaging. I can't see your wonderful faces, but I hear your voices through the chat. So thank you so much. Our next question is, how can communities take ownership in preventing gun violence? Man, think about that. Wow. And what should cultural sensitivity and trauma-informed care play in these efforts? Okay, man. So I'm gonna put mine, I can't put mine in the chat, but I'll say mine out loud. I'll say that I can take ownership, and because I'm trained to do de-escalation. So if I see something happening, I can help. That's what I can do. That's the ownership I can take. I'm just not gonna be like, well, I'm off work today. I'm not, not today. No, I'm going to use the training and the gift that I have. And so let's see what other folks are saying in the chat. Looking forward to it. Let's see what we got here. Yes. Community mobilization. Yes. Community support. Public health education in the community. Yes. Spirituality in a culturally sensitive and responsive manner. Yes. We see that. Our agency, in fact, is a faith-based agency. So no matter what faith people are coming from, if they need spiritual support in whatever way that is, we're able to help or guide them to a place where they can get help. Culturally sensitive, yeah, and responsive manner, for sure. So important. Conflict resolution training, yes, yes, yes. Neighborhood associations can organize and train people. Yes. Community-based violence intervention programs, for sure. The CBI ecosystem is growing, and it's a huge help in this work. Must have as able more participation in neighborhood associations. I agree. We have a great relationship with the neighborhood association that we're in, that we're involved in, Jordan area. Yeah, must have that. Support funding for schools and community programming. Yes. Can't put all the onus on law enforcement. It has to be that community programming. Yes. Thank you. These are great answers. Yes. Adding it to the agenda of all the associations along with voting education. Yes. All these are so important. Community agrees to a common value about guns in our community. That's right. We don't want them, right? Maintain playgrounds. Yes. How many playgrounds are missing now? My goodness, community centers and other alternatives. That's the reason why we decided we had to open up a youth center. The kids keep telling us there's nothing to do over here. Yes. Local policy advocacy. Yes. Amazing. Amazing. Yes, that's great. Awesome. These are some great answers. Thank you all so much.
I appreciate the opportunity that you guys have given us. So now I have the opportunity to bring on Ms. Lauren Feiersigner. We just call her Ms. Lauren F because most of the time, most of the kids and most of the people mispronounce her last name. And I think it is one of the coolest things. So I am very grateful, Ms. Connie, for being able to share your passion and your love and how you show up for community with us through this. I knew you were the right choice when I saw this, so I'm just humble and I'm thankful. So thank you.
Thank you for your time.
All right. Connie, thank you so very much. That was very insightful, and I just want to take a moment to check in. I know that everything that we have discussed thus far can be really heavy for some people who may have had direct lived experience with gun violence. And so I just want to use this opportunity to check in, just ask that you check in with yourself. If you need to take some deep breaths, please go ahead and do that. Our goal is to continue to have these very difficult conversations, but we really aim and strive to figure out how we can have these conversations in a manner that is responsive, and a manner that also honors everybody in terms of where you're at. I'm going to hold on for 1 second, pardon me, before my computer dies. I'm just going to plug it in. I'm going to ask that we take about a minute or two to check in while I get that done.
Well, I guess this is my time to shine. So right now, I've been going back through the comments that you guys were writing, and this is so impactful, right? How we show up in these spaces, some of the things that we can do within our own communities, how those things are impactful. And I love that people were talking about getting up and voting. I love that. So when we move towards this policy piece, I hope that you keep that love. And I have one more breakout session for you. So just keep your wheels going.
Awesome. Thank you for that, Nate. And so if you will see on your screen, we do have a visual that shows firearm legislation over the past 80 years. The reason we're sharing this is because we just kind of want you to get a picture of where this conversation began and where it's gone up to 2022. What you will also see as we talk about policy and as we reference statistics is that it was with intention that the statistics and data that is shared is up to a certain point to help illustrate how the problem may have begun or what the problem looked like at an earlier stage, and also to help highlight what happens when we don't actively and proactively also figure out solutions or talk about solutions, right? Part of what I would like folks to think about is if you look at 1934 and we're talking about firearm legislation, the United States of America was a very different United States of America in 1934. So when we're talking about utilizing policy, we have to really be thinking about who are the persons that are served by these policies, who are the persons that are tasked with the responsibility as it relates to curating and creating policy, administering policies, right? And so as you think about this from 1934 to 2022, can you imagine how the landscape of our local communities, actually even just at a national level, think about how the landscape of our communities has changed? And then think about, when you think of policy, who do you see in your mind? What comes to your mind, right? It's so important. And that's why I talk about, we have to be able to talk about the language of access, right? And so just kind of referencing this visual here, we know that gun violence is often the result of systemic policy failures, things like weak background checks, the lack of investment in social programs that address poverty and education. And then in the state of Minnesota, it wasn't until recently that we've historically struggled actually with we've had our own challenges implementing universal background checks. Another point of failure is just what happens when there is no notification of those failed background checks, right? So just to kind of give you an idea of some of the ways in which there are barriers. In the previous conversation, as Connie was leading us through, I heard a lot of your responses in being able to identify what we can do collectively, right? One of my key goals every time we talk about policy is to figure out how we can come into a space of coexistence and co-working, co-curating solutions, right? As previously mentioned, we do know that gun violence is not one person's problem, right? And that is why we talk about the desire to really look at this and approach it from a public health perspective, right? When it's looked at as an epidemic, we recognize that it doesn't isolate, nor does it impact or affect people in isolation or local communities. And so just thinking about everything that we want to talk about, what we want to focus on, we know that community and cultural factors are essential, but again, we know that it's also very impossible to talk about solutions without thinking about laws, without thinking about policies, and then what happens, how we roll those policies out, right? So from state legislature to federal courts, policy decisions have a direct impact on who gets access to guns, how they're used, and what happens after gun violence occurs. Minnesota is a state, as I previously mentioned, that we've seen both successes and setbacks, right? And as we're thinking and even talking about what happens during and or after gun violence, how many people actually often think about the cost of gun violence? This is one of the things I love to talk about. When there is a shooting, whether it's one victim, multiple victims, there are multiple communities, parties, persons that are impacted. And more often, traditionally, we will think about the cost of gun violence as the people or the most immediate, right? But how long does it take the persons that were directly impacted and in proximity to the shootings and being exposed, the trauma, how long does it take those communities and those people to actually recover from that? These are some of the things that are really important to make sure that we are grounded in as we think about solutions. So if we fail to actually recognize the type of trauma and the type of outcomes, negative outcomes that result as a result of being in proximity to gun violence, this is where we really miss some of these social determinants, right? There isn't actually investment in education. We fail to recognize how there can be investment, because a lot of times some people do not even understand what we mean when we say addressing poverty. How is it that we can address poverty and then at the same time be able to actually speak to gun violence and its reduction, right? Can we go to the next slide, please? Great, thank you. Perfect. When we think about who is responsible, right? This visual on your screen here will give you an idea of the comparison of the average rates of gun violence outcomes in states with the strongest gun laws as well as those with the weakest. The green being the ones with the strongest and the red being those with the weakest, I believe. Yes. This data will go up to 2011, if I have it correctly. 2009. And so part of what I said earlier on, we want to make sure that we are actually helping you think about where this problem began, right? So when you look at all the states that actually have the strongest gun laws and those that have the weakest gun laws, when we think about how that's going to impact our communities, you can actually see such a jarring difference as it relates to what happens in the interim, what happens in between, right? In terms of responsibility, I actually heard some folks on the chat respond that responsibility is not just left to either lawmakers, it's not left to law enforcement. This is a collective community approach. This is a collective problem that does not isolate, it does not discriminate. We are all impacted by gun violence, and whether or not you actually have been in direct proximity to a gun violent event or shooting, or you just don't know. And I'll give you an example. I do human resources work. I do a lot of DEI work, and it wasn't until a few years ago that I actually had the pleasure, the honor of being able to work with communities that are impacted by gun violence. Prior to that, I was also very heavy in policy as it relates to figuring out how we actually can break down policy into small bite-sized chunks so that the everyday person can understand, recognize where they fit in as it relates to, lawmaking, speaking up for change in their own local communities. As a person who did human resources, as a person who had never been exposed to a community that had been impacted by gun violence, my response to the workplace culture, my response as it relates to even just diversity, equity, inclusion, and access was greatly different from what happened after the fact. So I support an organization that actually does this work. They offer community intervention, violence intervention models, and programs within the communities in North Minneapolis, to be specific. When an employee of ours comes in and says, I cannot show up to work, or just yesterday, somebody I know was shot, that then forces me to think about what is my response as a person who is responsible for human resources, right? Responsible for setting the tone for workplace culture. How do I respond? Prior to actually taking the time to even educate myself, I could not have understood, I could not have fathomed what it takes for human beings to take their physical bodies and still have to show up to work, right? After their cousin was shot, after they had to attend a candlelight vigil, after they had to go to a funeral for the umpteenth time in the community, because we are losing children, we are losing adults, we're losing community members to gun violence, right? And so part of this responsibility, really, it's not just even at a macro level. Where you are at right now, with what you have right now, you have the ability, the capacity to be able to reach out, to extend a hand, to extend, even just ask questions, right? Who are you serving? Let's get to know one another, because when we get to know one another, we get to understand the stories as well as the burdens that our employees or local community members generally are carrying, right from where that person woke up or didn't wake up from that morning to the point where they showed up, right? And so again, going back to the policy side of things, right? We know that gun violence thrives when policies are either ineffective or unenforced. And then in Minnesota, we've seen that there are legislative gaps, like the delayed implementation of red flag laws. They allow individuals who are at risk of committing violence to remain armed. And this has been huge, as we have unfortunately even seen this breakout and this growing epidemic of gun violence. And as we think about even our children, and then when we think about persons who have mental health diagnoses or challenges, there are ways in which these people should not have had access to firearms in the first place. But because of some of the ways in which policies have become very politicized, and we talk about gun violence, unfortunately, right now in a manner that is very bipartisan. The problem, though, is when a young person decides to take a firearm and step on a school campus, it doesn't discriminate. They don't shoot based on partisan policy lines. When we have a young person who has historically been disenfranchised, when they start to shoot, they're not going to discriminate and say that this is along party lines, right? They're not going to discriminate and say this is along economic lines. Because mental health affects everybody, right? There's no such thing as, and we should also never be thinking about things like it cannot happen to me, right? It cannot happen to me, or I live in a specific area where we are not going to be exposed to that. My taxes are high enough that my community will never have to experience that. Well, what you don't know is how far one individual will travel and how far trauma will take a person to put them in a position where they're going to then be the next active shooter. What do we do then? What do you do when your 16-year-old texts you from their school campus saying, "Mommy, Daddy, there is a shooter on campus"? What do you do about that? Right? And so this language of access, part of what I really want to be able to help you think about is how can we have a conversation about the language of access from a policy standpoint? A lot of times, and historically, what we have seen is that a lot of us do not seem to understand what we mean when we say policies and where we fit into this picture when we talk about policy making, right? How many people, just by a show of hands, how many people, let's say even at age 25, if you are past the age of 25, how many of you at age 25 understood that you could pick up a phone and find out who your local area representative is? You could pick up a phone and say, "Hey, I would like to have a conversation about something where I live because I pay taxes here." How many of you at age 25 even knew, for example, that you can actually write a letter, right? Just by a show of hands, if you will, if you were able to, can you let me know how many of you actually understood that you could engage with your lawmakers at age 25? That often doesn't happen. We don't see that happening a whole lot, right? And the reason we don't see that happening a whole lot is because policy has been discussed and policy has sort of been shaped over the years. As if you recall the visual that I shared earlier on, 1934, when we started seeing any type of movement around gun legislation, firearm legislation. 1934 was a very different type of United States of America, right? When we think about who actually was represented when they were talking about policies, right down to 2024. Now in 2024, we have young people who understand who they are, who understand that they belong in these communities, and they understand that they also can participate as it relates to lawmaking, policymaking, right? But that doesn't just happen when it's time for you to go and vote. That happens when you see something that does not work for your community as an individual, when 5 neighbors come together and recognize that things are not working. You have both responsibility and right to be able to go into, to find out who is actually representing you at a local level. And then you can go all the way up to the federal level if that is something that you choose to do. We need to be able to have conversations as it relates to how do I identify who represents me? Where I am right now, how can I understand who represents me? And once I know that, what can I do? You may call in, you may write, you may actually go and visit your local lawmakers. You have every right to talk about these things as it relates to how gun violence is impacting you. And this is where accountability falls in. The persons that are voted into public offices are not just voted and left there without any form of accountability. The mechanisms of accountability are you and I, right? The people that are not sitting up in office. You and I have a right and a responsibility to actually hold elected officials accountable as it relates to what it is they're doing. Right now, as we talk about gun legislation, part of the thing that we see is that it has become so heavily politicized in a way that if it's not serving one or the other party, then it's going to be stalled. Meanwhile, our children are getting shot up on school campuses. Meanwhile, our local communities, we have 12, 14-year-old boys, children, girls, who actually have access to firearms. How does that happen? In 2024, how are we actually able to say that we are, first of all, we are in a community where a 14-year-old or 12-year-old can find access to a firearm? There's something deeply disturbing about that. And when these shootings actually happen, what is our response? How can we also have these conversations without already placing a heavier burden on communities that have historically been exposed to both trauma as well as having to do the legwork of teaching, right? We've seen that in historically different disenfranchised communities, persons who actually suffer this trauma are then also tasked with having to teach, quote unquote, lawmakers, quote unquote, those with solutions. It's not the responsibility of our communities who have not been given access to resources. It's not the responsibility of our communities who have never been given support as it relates to funding for schools, funding for recreational areas, right? And even just simple education as it relates to voting. Those people who have never had access to mental health services, right? They are not supposed to be tasked with this burden of then coming in and finding all the solutions by themselves and saying, we're going to solve it. Because be that as even if this gun violence might disproportionately affect or impact a specific area or community, it actually then impacts and affects all of us at a local community level, all the way up to a macro level when we start to talk about the quality of life, right? What is the quality of life for the average person living in America when you have no certainty that you send your children to school and that they will come back to you safe, that you can go and spend a Saturday afternoon at the mall and you will come back safe, that you can just be driving your car and that you will make it back home safe. This is how we need to be thinking and talking about it. Would you please take me to the next slide? All right. So when we talk about who is impacted by gun violence, before I even break this down, I just want to make a note. I will share that responsibility from a policy standpoint does fall heavily on lawmakers and lobbyists. We've seen political power of groups like the NRA, how they've historically blocked key legislation and prevented that could prevent gun violence. Meanwhile, many lawmakers, particularly in states like Florida and Texas, have passed laws such as Stand Your Ground and other permissive policies. Those policies we've seen that have actually fueled violence rather than reduce it. Responsibility also falls on us as voters, as I previously mentioned. It is our responsibility to understand how we can educate ourselves among one another. So if I'm a person who has access to policy, if I'm a person who understands how policies are made, part of what I can do with this access is go back into my local community and have conversations. Part of what I can do is organize and figure out how we can get more people who are well-educated, well-versed to come back into our local communities, talk and teach them about what voting means. How do we exercise our civic duties to be able to hold locally as well as nationally elected officials? How do we hold them accountable using the power of the vote, right? And then as I talked about also, in places like Minnesota, we've seen that public opinion often supports stronger gun control, but political inertia has slowed the progress. Unfortunately, this is not just in Minnesota. We see that this is something that is happening nationwide. Public opinion can be one way, but then when you come to the political side of it, there's such a slow rate of actually doing anything about it. And this is where oftentimes I say, how do we humanize policies? Humanizing policies is making your locally elected official understand that while they are talking and having debates on floors in a partisan manner, your child might not make it home. While these conversations around and about gun violence are actually had in a partisan manner, we're not able to access things. You just cannot, as an average person nowadays, go to the mall and be assured of your safety to come back home, right? These are ways in which we can actually begin to stand a lot more and start to talk and hold our locally elected officials accountable. We know that gun violence disproportionately affects Black and Brown communities due to historical policy neglect. Poor access to healthcare, education, and employment opportunities will often correlate with higher gun violence rates in these communities. It is unfortunate that this has become the status quo when we talk about gun violence, that we know that it is going to be in Black and Brown communities. This is not something that we ought to be saying as, oh, this is just the reality of it. There is something critically wrong when we see that historically, and even now, the data continues to trend in a certain space. There's a certain group of people that continue to be left behind. There's a certain group of people that continue to not receive the support that is due to them. And because of that, we continue to see how gun violence is going to keep climbing and climbing in those communities. And the cost of that is so crippling and takes far more than just decades to actually repair. So we need to be thinking about how to be creative and think outside the box. How can we think outside the box as a community? How can we come together as a community? Various communities, culturally diverse communities, religiously diverse communities, communities that are diverse in income, communities that are diverse in gender. Every aspect of our being makes no difference when it comes to gun violence, because gun violence does not discriminate on any basis. It affects every one of us. And then when we look at the specific, specific examples of how policy impacts gun violence, we've seen that states like California have seen success through measures like the universal background checks and strict red flag laws, which have reduced gun-related deaths. On the other hand, states like Texas and Florida, as I previously mentioned, their more permissive approaches, such as that stand your ground law, has allowed for an increase in racially charged shootings. In Minnesota, we're just starting to see the benefits of the red flag laws, but we still have a long way to go in terms of addressing gun violence at a systemic level. This is very true for not just Minnesota. This is very true everywhere around the country. And then as we also think about those these red flag laws and all type of laws that we're trying to think about and have conversations about, we need to understand what happens. We need to understand who is mostly impacted when we have states pass things like your stand your ground law. Looking at the landscape and the history of this country, who is at risk or at higher risk to be impacted, who is at higher risk to then be gunned down, right? To be vilified. I heard somebody say, I saw a comment earlier that said anti-Blackness, right? Anti-brown skin, anti-BIPOC. What does that look like and what does that mean? When we allow certain policies to pass, when we as individuals and communities think or believe that the only way we can hold lawmakers accountable is by going to the polls. Let's start having conversations about what we can do in the interim. When we're not going to the polls like November, when we're not going to the polls to vote for locally elected officials in our own areas, what are we as a community doing? Do you know what impacts your Somali brother next door? Do you know what impacts your counterpart? Do you know what impacts your Native sister next door? How are we having conversations about how gun violence has actually historically impacted them? How are you creating and holding space in a manner that you can hear someone else's perspective without vilifying them? How are they doing the same for you? And how can we take the outcomes of all of these conversations collectively as a diverse community, as diverse voices collectively to those people that we then give the responsibility of our votes, right? And say that they need to make laws. Thank you so much for your time. I will hand it over to Nate at this time.
So I was going to do a whole nother breakout session, but this is so impactful. When I envisioned what this would look like when we got together and we put these slides together and we talked about what are the things that we wanted to bring to you guys today, I thought about it. I was like, man, there's so much stuff that I wanted to hit you guys with. And trying to be very mindful of time, right? I am going to give everybody access to my slides. My whole slide deck you can have with all my speaking notes on it and everything. So much, right? So for me, data is bigger than what we think, right? Right now I put up a subject of a heat map of all the areas in which gun violence has been. And so when I think about data, I think about the intangible things like speaking truth to power, right? Like, because everybody's like, oh, let's dive into the data because data doesn't lie. The fact is when you don't ask the right questions, data can give you a specifically different question, a specifically different answer. So it's things like Connie, it's things like Miss Lauren, it's things that are intangible that we will never be able to get unless we have the willingness and the wherewithal to go and ask the questions, right? Gun violence is not an abstract issue. It's actually one of the ways that we can actually physically, measurably map out ways in which things show up and incidents across the world. It's funny enough that when we look at it through this map, we can tell that all these are happening specifically in high concentrations of Black and brown neighborhoods. Funny thing is, I just don't think that's a coincidence. For me, it's a reflection of systemic inequalities that plague not only my community, but everyone's community. So when we think about what that looks like, the different systems of what it shows up, and how it delivers, it's a deeper issue. So when I think about what data looks like from a tangible space, it's how do we look at poverty? It's how do we look at unemployment? It's how do we look at the access of education? It's how do we look at cities that have higher concentrations of specific places? It's how do we look at the infrastructure? It's how do we look at all the things that put us in spaces where it's not just the presence of guns that's bad, but it's more about the absence of opportunities. We fall into this space of not allowing our communities to flourish, but instead we allow violence to flourish. And for me, that's scary, right? It's terrifying. It's disheartening, right? And when we think about who's responsible for it, well, the answer is complex, right? Because individuals, right? We ain't said the people who shoot people are the people responsible, right? Absolutely. 125%. That's not the real answer though, right? Where here in the Twin Cities, we think about all the things that's happening. We think about all the things that's happening, like access to guns, right? I know milk is $6 a gallon. There's no way that you can afford to eat and have a gun, right? There's so much that's responsible for these things, right? Who's impacted? I don't have to hit this narrative again for you. I don't need to tell you that Black men under 35 are significantly marginalized by this. I don't have to tell you that 58% of gun homicides are Black people. I don't have to tell you this, right? Because I'm assuming that you should already know, right? And the problem is we take too much time to assume that people know without saying this data, or without saying the thing, or without speaking the power, or without doing the things, right? So let's think about how we support them. So many people was talking about, oh, I love Cure Violence. I love the things that we do. I love all the things. I believe in community. I believe in Miss Connie. I believe in Miss Lauren. I believe in the Hope Project. I believe in the Father's Right Project. I believe in We Push for Peace. I believe in all the people who are out there doing the work in the spaces in which we can. And me working in spaces where I have an opportunity to impact the lives of not only the internal customer, which is the people who are helping the people, but the external customer as well. It's when I think about success and what that looks like, I think about people like there's an organization in New York who did about a year, I think it's 2 years now, right? Of a project that was specifically solidified and riddled with guns and bullets and opioids, because that's the new word for it. It's been 2 years without a single shot. 2 years. 2 years of being the specific fight to power to address the issues and to how we change and what outreach specifically looks like. And one of the craziest things that they had is they brought data into it. Well, a good friend of mine is the epidemiologist over there, and he finds ways to make to make numbers speak. So one of the things that I laugh about, and one of the things that they give me as a title is, I don't use data as just a tool. I use data as a mirror to hold up and support the people who are there. It's how data shows up and we ask the right questions. It's how I get data to Miss Connie. It's how I get data to Lauren. It's how I get data to every person that's here. It's how those things that nobody else in the world can get other than you and the people in which you serve. How do we break the cycle? This is actually me in this picture. Me with a group that, you see that hoodie that she has on? That was us in 110 apartments over where it was so bad. Since our presence, it went down 94%. Just the presence of hope, 94%. I have 3 minutes left, and there is not enough time for me to tell you all the things. So I'm going to be true to myself, and I'm going to give you the actionable steps that I believe that it takes. Creating safe community spaces, because we can't do anything without community. Nothing can be done for us without us. Y'all know the saying, nothing can be done for us without us. So when I think about what it means to be in that space, I think about people who are public health practitioners, people who are going into this, not because you're interested in the money, but because you're interested in real life change. Let me show you why I do it. Achilles, I'm gonna bring my son here so you can see what it looks like. Please, I am available for everything. As I close this, I want to thank you all for having us.
Great.
Thank you all so much.
Great. Yo.
Please keep the conversation going and your ideas amongst each other.
Thank you all for your time.
My world wasn't girls get to know me. Alexander was cool, but he got nothing on my big homie. Outside where he reside, not too far from Morgan Park High, where he was who would die.
Thank you all. I appreciate everyone for speaking today, as well as for joining us. We hope to see you soon at one of our events in the future. Please fill out the email that Sarah shared in the chat, so we know what to do going forward with these events, and also can share with our speakers how much a difference they make. Thank you all. Have a great day.
Thank you all. Thank you, Lauren Jones. Thank you so much. Appreciate you.